Hey guys, there's one song that is coming inside my mind when I started this live, that is Bara, 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 Bara. You must be wondering what is this Bara and what is Vivin gonna talk about Bara or anemia in this live. I have Dr. Anjali today, so she will be joining me in some time and we will be talking about anemia. So we want India to be anemia free. So to do that, what are the things that, it's very important to educate ourselves. So in this, the main intention of this live is to educate women over there who are having very less knowledge regarding anemia or women health and everything around that. So please stay tuned. This is going to be a very short live session with Dr. Anjali, and it will be very useful for you guys. So please do watch completely. I'm going to add doctor now. One second. So talking about Dr. Anjali is from Bhopal. She's a gynecologist and also she's an associate professor. Hi, doctor.
Hi, this is Anjali.
Hi, doctor.
Hello, good morning. How are you, Vivin?
All good, doctor. How are you?
I'm fine, thank you. You are in all red color to show that, yes, anemia needs to go out.
Yeah, totally.
True. How are you doing?
All good, doctor. How is it going? So you were busy in the hospital, I heard.
Yeah, it's been going on and on and on because my hospital is a COVID dedicated center.
Yeah.
Yeah, even in my department, I'm in Department of Obstetrics and Gynecology. We have been dealing with pregnant patients who are coming up with positive. We are taking care of them during delivery and post-delivery also. I have a working team with me, and because of the working team, I'm able to sit here with you today so that the team is taking care of all my patients.
Yeah, we all are very, very proud of all the doctors out there who are, working in the hospital day and night, serving the COVID patients, even putting their family into the risk. Thank you so much, Dr. Anjali. So I just want to take this platform to thank you and all the doctors out there.
Sure. Thank you so much.
So, doctor, let's come back to the anemia topic, and we want India to be, anemia free. So, what are the things that we need to do, and everything I'm going to ask you so that we share knowledge, so that we educate people and the women who are watching this live. And so the first thing I heard about this anemia campaign, and I also heard that 38,000 for hashtag more than Bara. So, can you explain what is that? 38,000.
Actually, these are all the doctors who have been involved in this campaign, and more than Bara. Actually, when we talk about anemia, we need to find out what is the hemoglobin of the patient, or if not a patient, a person. Hemoglobin is the thing which tells you whether the patient is having normal blood iron levels or is having less levels. Normally, as we talk about female patients, the hemoglobin level should be more than 12. Okay. That is why the slogan goes as more than Bara. More than 12 is for Bara. So that if we aim for a hemoglobin level which is more than Bara, we are able to prevent many problems in female life. The problems start from early childhood. They have been divided into a couple of criteria as far as the age goes. It is divided into less than 5 years, it is more than 5 years, it is in adolescent age group, then in pregnancy, lactation, and so on. Okay. The main area is the reproductive age group, which is my target. But when we talk about the preventive aspect or more than Bara, the target should be right from a childhood. So if we do a simple hemoglobin test, which doesn't take a long, and if we aim at having a hemoglobin level more than Bara, we will be able to take care of many problems in a women's life.
Okay. So what are the causes of hemoglobin level going low? I mean, what are the reasons for it usually?
let us start from before birth in a female or in a woman. If the
Yeah.
mother is anemic, the baby is going to be anemic.
Okay.
So, vicious cycle which keeps on going. That
Yeah.
is why we target for a pregnant patient to have even more than Bara, we are taking care of the baby or the neonate.
Mm-hmm.
The reason for childhood anemia is to some extent malnutrition, or maybe I'll say that not exactly malnutrition, but nutrition, where we are not able to concentrate on what to eat and how to eat and what all precautions need to be taken. That is another thing. In case of pregnancy, what happens, even if the patient is eating well, her
Yeah.
demands are going to go up,
Yeah.
and she needs to be aware about these demands. If
Mm.
she is able to take care of these demands, then only her own blood levels are going to go up. It used to be said that a pregnant patient has to eat for two people.
Yeah.
Now that is true. Somehow that is not true. She doesn't have to eat, maybe if she's eating four biscuits, not eight biscuits this time. But yes, she needs to take care of the nutritional aspect of what she's eating.
Mm.
And she needs to put certain elements in her diet. She is a non-vegetarian, maybe she can concentrate more on meat or egg or seafood products. But if
Yeah.
she is a vegetarian, she needs to eat more leafy vegetable. And I understand and I know that India is a place where all of us are not able to eat what is recommended. Not all can have leafy vegetables, not all can eat dry fruits. But yes, if she, what we do our patients, if you eat even chana and gur, which is the
Okay.
easiest, yes, or what is called as chicky,
Yeah. 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 Chicky. Yes.
peanut and gur. These two
Yeah.
things are said to be very good in preventing iron. So even if they inculcate these small, small changes in their life when they are pregnant, these will
Okay.
take a long way. And there is
Okay.
physiological anemia which takes place in pregnancy because their demands increase and there are certain changes which take place in pregnancy, mainly during third trimester. There is hemodilution of the blood, which leads to pregnancy-related physiological anemia. There is these
Mm-hmm.
requirements. So if one realizes that these things are going to happen, and if they are able to take care of these small issues, uh,
Mm-hmm.
we can lead to anemia-free India.
Okay. And also I wanted to ask you, doctor, how important is this iron drops for the baby, which they give, no, once the babies are on fourth month. So they are given for my baby. I mean, is it important, or can that be balanced with the balanced food?
No, though you can take care of everything with a balanced diet or a balanced food, but these are additional requirements which are fulfilled. And yes, there is always a thought कि मैं तो अपने बच्चे को सब खिलाती हूँ, then why should I give these drops? These
Yeah.
drops, when we come across in pregnant patient, many times we are asked that I'm eating a balanced food. Why do I need to take iron and calcium? See, the
Yeah.
balanced food is going to take care of your daily requirements. Daily requirements. Even with a baby, they are going to take care of the baby's daily requirements. What is given more is going to have uh, is going to supplement their what should I say? Their results are going to be uh, taken care of with this. Their bank balance is going to increase with what we are providing. So when they need this balance, they can use it. So fortification is definitely important, and with fortification, dietary modification or what you are seeing extra add-on is definitely required.
Okay, okay. And how important is iron supplements during pregnancy, and also for how long one should take iron supplements after the delivery?
See, when we are talking about iron supplements, again the thing is the same. Iron
Yeah,
supplements are going to provide more iron to the patient.
as well as
So
baby.
yeah, and the baby, definitely.
Yeah.
So this again is going to put her reserve on a higher end.
Okay.
I tell my patients many times with pregnancy they have tendency of having lot of dietary imbalance. They need to today with something, they will not feel good today with the same thing tomorrow. Sometimes they are able to tolerate iron tablets, sometimes they are not. When we are talking about supplements, I usually end up telling my patients that take them when you are feeling good. It is not like you have to take them. It is not like, yes, if you don't take them, your iron are going to go down. No, definitely you need to take them, but they should not feel like what should I say? They should not be overburdened with this. कि अरे आज मैंने iron नहीं लिया तो something is going to go wrong. It's not like this. They need to take iron, but it should be as a supplement.
Okay.
So if they do proper supplementation and balanced diet, definitely their iron stores are going to be good. They will not have anemia. Their hemoglobin level is definitely going to be more than Bara.
Okay, okay. And how do we get to know that our hemoglobin levels are low? What are the signs and symptoms?
The signs and symptoms of anemia are definitely like weakness, tiredness, fatigue, breathlessness. Some physiological breathlessness do take place in the trimester and third trimester of pregnancy. That is because of increasing weight. But if it is more than that, definitely these are the signs. These are the symptoms by which one needs to be aware about that this could be anemia. As an obstetrician, we do hemoglobin check at routine intervals. We do when a patient gets pregnant, we get a baseline of routine hemoglobin. And after when the patient reaches in second trimester, definitely we do a repeat hemoglobin level. And in third trimester, when they are close to their delivery, we definitely ask them for their blood investigation. So at least these are the 3 times when I ask my patients to have their hemoglobin levels done. If these symptoms are there, then definitely they need to undergo an investigation, which is a very simple investigation called a complete blood picture, by which we get to know the hemoglobin level, the complete red cell count. We need to get some other investigation or marker, what we called as red cell indices, which is MCV, PHC, and all the volumes. The blood cell volumes are there. And the another thing which we get many times is a peripheral smear for comment, which tells you what is your red cell, how does they look, and whether the anemia is there or whether if they have any issue. This is the simplest test which can be done at any pathological lab and doesn't cost much also. So a simple test like this can take care of the hemoglobin level.
Okay, okay. And also, the doctor, when we were kids, they had told to see here, that, if you see some white line there, then you're anemic. And also,
these are the signs by which you can identify anemia. You can check your palm. You can press your palm and open your palm and see whether it is changing color. If you get a good pink color, this means yes, your hemoglobin level is good. If it looks, then definitely you have to think about it. You can press your nail bed and see whether the nail bed turns pink when you leave the pressure. And then you can see the tongue, the backside of the tongue, and then you see whether you are having anemia. What we teach our undergraduate student is or to see, look at the conjunctiva and see whether the conjunctiva is pale. And that is one of the signs of early identification of anemia. In pregnant patients, if the patient is having edema, what is called as paromesuzal, if they have that, then definitely this could be one of the signs of anemia in pregnancy. So these are all the signs by which a patient, definitely if they have any one of these, they need to have an investigation for anemia. Non-pregnant women, again, the signs are the same. If the person is having a lot of tiredness, of breath, easy fatigability, if suppose they are unable to walk for longer distance, palpitation hota hai, definitely these are the indications by which you need to have a hemoglobin test done.
Okay, okay. And what are the worst cases that happens if the HB level goes really low?
If hemoglobin level is really low, then they start having all other issues by which they definitely have problem. They will have breathlessness, If the patient is non-pregnant, they can come as abnormal uterine bleeding. This is the extreme corner of age group 40, 45, 50, and their hemoglobin level starts going down. The medicines, they don't work, and then they end up having hysterectomy, which is removal of uterus. If in non-pregnant patient, these are the scenario. But in pregnant patients, if the hemoglobin level is really low, it starts affecting the baby. The baby will not put on weight as he or she should. Then there are more chances of having problems in labor. The patient will not be able to tolerate labor pains as any other patient with good hemoglobin level will, because the threshold is going to go low. A threshold with any other normal patient is going to be different than a patient who is having anemia. The threshold of tolerating labor pains is going to go low, down, which is very important for a normal delivery to go down. And the worst part is the patient who is having anemia post-delivery, they are more prone for what we call as postpartum hemorrhage, which is a dreaded complication. And we have a lot of maternal mortality because of this complication. So by simply preventing anemia in pregnancy, all these problems can be taken care of, and we can prevent all these things.
Okay, and somebody's asking what are the
what are the general home remedies? The general home remedies are right from start, keeping good hygiene, not keeping big nails, keeping the underbeds very clean, because these are the cases where you can have worm infestation, and worm is one of the primary cause of having anemia. Even in children, it is said to be the commonest cause of having anemia. So this is the hygiene of it. When we get leafy vegetables, we need to clean the vegetables, and we need to cook them in iron pots, which will provide more iron when we are taking it. To take balanced diet. As I told you, the remedies could be taking proper food, as well as taking chikki, chana, gur. These are the common things by which we can prevent anemia. And then you can, then you can, the higher end, you can eat dry fruits in which you have apricots, walnut. These are the things which will help. Raisins. Raisin is said to be black, is said to be very good for prevention of anemia. So maybe those things will definitely work well. And these could be small things which you can take care in home also. I think another thing you can take care of is if you help your nearby people who are working with you, or maybe close network kids. If you maybe we are doing so many things for birthday parties. We were not right now, not in the COVID era, but we were doing so many things for birthday parties, giving return gifts, and so many things were going on. So I think it could be a little bit scary for the kids, but for age group 11 plus, 12 plus, if we can just offer them having a simple hemoglobin test, just a simple hemoglobin test, maybe they realize that, okay, our hemoglobin is more than 12, that will make them feel good. And the message will be spread to the youngsters and the same generation age group that, okay, this test is very simple and can be done with ease, and if your hemoglobin is more than Bara, then definitely you are at a safer side. And this awareness, the message of knowing that hemoglobin of at least 12 has so much of significance, makes them realize that, okay, they need to look at this aspect of life also.
Yes. Thank you so much, ma'am. You had shared, lots of information. There was so many information which I didn't know. I really found this conversation with you very useful for me. I'm sure the viewers who are watching also had found it interesting and informative. Thank you so much, ma'am, for taking out your time. I know you're busy. Thank you so much again.
Thank you. Thank you so much for making me a part of this. Thank you. Thank you so much.
Yeah, thank you, ma'am.
Bye-bye. Bye-bye.
Bye. Okay, guys, that was it. So Dr. Anjali was here, and she had shared so much of information regarding, the importance of iron in our body, the supplements that you can take, and why it is important for a woman to have her HB level more than 12. So if you're facing some of the issues which doctor had mentioned, I'll be saving this live. You can go back and see what are the symptoms to know that your HB level is low. uh, please do have a check if you're feeling very tired, if you're feeling breathless, if you're feeling very tired very quickly, then please do get your hemoglobin test done and see whether your hemoglobin is more than 12. If not, please start taking supplements, have natural food. So doctor told that you can have chicky, so you can have chicky. So in our house what we do is our morning starts with fruits, and the one fruit that is constant is Viara's favorite, anar. So we have anar every day in the morning. Please do have a check on your hemoglobin. Don't go to neglect your supplements. Please take care of yourself. Lots of love, and take care. Have a nice day. This is Vivin signing off. See ya.